Good afternoon, everyone. My name is Happiness Ude, and I'm a mental health nurse practitioner. So, today we're going to be talking about the mental state examination of a patient. As mental health nurses, our daily assessment of a patient does not as mental health nurses, our daily assessment of a patient does not just stop with the usual head to toe examination of a service user. Mental health nurses carry out what is called mental state examination. So, by definition, mental state examination is a series of assessments done to check out for the cognitive and behavioral functioning of a patient at that given point in time. You know, when you do something like a screenshot of something, yes. So, mental state examination is done at that time. You don't use the assessment carried out 2 days ago, yesterday, or 3 hours ago to judge a mental health patient at that time. So you do it, it's like a routine task carried out um, on this patient. So there are a series of things you watch out for when carrying out a mental state assessment or examination. First, we're going to talk about something like the behavior. The behavior is usually the first thing the nurse should assess when carrying out a mental state examination. How do you assess the behavior of this patient? You assess the behavior of the patient as the patient is coming towards you, or the moment you approach a patient in their room, how do they react? Do they startle? Do they jump out of their bed? Do they compose themselves? Do they look at you? Do they welcome you into their room? Did they respond back to the greetings you gave to them? Because any behavior this patient displays serves as a pointer to making an accurate diagnosis of your patient. Appearance. The appearance is another thing the nurse should watch out for. We know that in some conditions like depression, people lack drive. People who are depressed lack the drive to even look after themselves. Now, the appearance of a patient tells a lot about the mental state of that patient. What do you look out for in the appearance of the patient? How they are groomed, how they appear, the type of clothes they wear. Is it appropriate for the weather? Do they just put on layers and layers and layers of clothes? Are their clothes clean? Do they wear a dirty cloth on a clean cloth, or do they wear a clean cloth on a dirty cloth? This also serves a pointer to making a proper diagnosis of a patient. The mood of a patient. The mood is another pointer to a patient's assessment. How is this patient appearing? Do they appear happy? Are they sad? Are they ambivalent? Are they content in themselves? Are they euphoric? All these serve as a pointer. And as a nurse, when you're assessing mood, you should also assess the affect, because the two of them goes hand in hand. The mood is subjective. That is, it is what the patient tells you. Why the affect is what you see. Sometimes the mood is not congruent with the affect. That means it's just opposite. A patient tells you they are happy and then they appear sad or flat. It serves as a pointer to making a good and proper diagnosis. Orientation is another form of assessment. Is the patient well oriented to time, person, and place, which is usually the three factors that is judged during orientation. You ask a patient where he thinks he is at this time. The patient may be in their homes or they may be in the hospital. The response the patient gives serves as a pointer to making a proper diagnosis. A patient could be in their home and say, "Oh yeah, I'm in a hotel. Can't you see the hotel hostess are serving me?" When they're actually nurses, you see, sits his wife and you ask him, "Who is this person to you?" I tell you, "Oh, that's my neighbor." He can't even identify their wife. So it is a pointer to making a proper diagnosis. The nurse also has to assess the speech of this patient. How is this patient talking? Are they talking too loud? Are they talking too low in tune? Are they talking continuously non-stop? Because it helps to give a proper diagnosis. Let's take, for instance, someone who is in a manic phase of bipolar affective disorder. You see the patient continuously talking, jumping from one topic to the other, just continuously being excessively, what is it called? Excessively loud. It helps us to make a proper diagnosis. So you assess the speech of this patient. Are they having normal flow of speech? Is the speech just jumpy? Are they having something called word salad, that just mixing up one topic with the other? The nurse has to assess. the speech of a patient during a mental state examination. The nurse also assesses the eye contact maintained during the assessment process. Yes, it is understood that in some cultures, people are not expected to look at the other person eyeball to eyeball. So the nurse must also put into consideration cultural differences when assessing eye contact during a mental state examination. Another thing to assess during a mental state examination is the insight. Does this patient have insight into their mental health needs? Because the level of insight they have will determine the type of care they receive, determine if they need to be detained under the Mental Health Act or if they just need to be treated as an informal patient. Another thing to assess is the perception of this patient, what they perceive, what they feel. It helps to make a proper cognitive diagnosis. Some patients, we watch out for things like hallucinations and illusion. How do you ask questions related to hallucination? Ask them if they are seeing some things others cannot see, or if they are hearing things others cannot hear. And also, some of them could just feel something. They'll tell you that something, they feel something crawling on their skin, which is tactile. So the nurse asks questions about hallucination in order to elicit some perceptual disorders in a patient. I have a simple acronym which I use in identifying what I should ask a patient or what I should watch out for when carrying out a mental state examination. I simply call it BAPTOMEJI. BAPTOMEJI, where B stands for behavior, A stands for appearance, P stands for perception, T stands for thought process, O stands for orientation, M stands for memory, E stands for eye contact, M memory or mood, memory slash mood. E, eye contact, J is judgment, and I is insight. If you want to learn more about mental health nursing or mental health in general, subscribe to my YouTube channel, like and follow, and continue to watch. I remain your humble self, Happiness Ude, mental health nurse practitioner. Thank you for watching. Follow and like for more. Bye. See you next time.